During this video, we are going to demonstrate how to take blood cultures using a sterile technique. This is particularly important for babies who have central line access or for babies for whom we are querying whether they have a blood culture contaminant. Before preparing equipment, you need to clean your procedure trolley with a Clinell wipe. Start off by opening your sterile dressing pack, which contains drapes, a plastic bag, gauze, and a plastic container. Make sure that you don't touch the inside of the packaging when opening the dressing pack, so not to contaminate your sterile field. The equipment required includes a 24 gauge cannula, two 28 gauge green needles, a ChlorPrep skin cleaning lollipop, a syringe, and of course your blood culture bottle and chlorhexidine and alcohol wipe. Make sure you check your blood culture bottle has not expired before starting. Remove the lid of the blood culture bottle and clean it with a chlorhexidine and alcohol wipe for 20 to 30 seconds and then allow to air dry. At this point, you would put your hat and surgical mask on and don your surgical gown and 2 pairs of sterile gloves. You'd wash your hands using antiseptic solution before doing this. Before you start, make sure you've prepared all your equipment. If you were leaving the cannula in, you'd have Tegaderm and an extension set primed with saline, which we have not shown in this video. You would need an assistant to help you draw up the saline as you are already sterile. Once you've selected which limb you're going to use, put a sterile drape underneath your patient. The back of the hands and feet are preferred sample sites. Click the wings of the applicator before starting, making sure that the solution has reached the end, and then use it to disinfect the skin over your selected vein. Use gentle up and down and back and forth strokes repeatedly for at least 30 seconds, then leave the area to air dry completely before inserting the needle. Whilst the skin is drying, remove your first pair of gloves and dispose of them. Now is time to insert the cannula and take the sample. So important not to touch the insertion site after you have completed the cleaning process. Once you've got your cannula in, you need to collect your blood sample. So depending on the weight of the baby, this should be at least 0.5 ml for a baby under 1 kg and at least 1 ml for a baby over 1 kg. If you are unsuccessful the first time, then change your gloves and repeat the cleaning process for the new site. If you're taking other blood samples, make sure that you do these after you've taken the blood culture sample. Once you've got the sample, you need to change your needle and inoculate the blood culture bottle with your sample. Make sure you inoculate the bottle before taking other blood samples. Once you've finished, either secure or remove the cannula and dispose of your sharps safely.